All right, hello everyone. My name's Kim Gould Ashizawa, and I'm with the Japan Center for International Exchange, better known as JCIE. It's my great pleasure to welcome you to our webinar on disaster preparedness and response for aging populations. JCIE and our partners at the Economic Research Institute for ASEAN and East Asia, known as ERIA, have been holding a series of webinars as a part of our broader programming on healthy longevity in Asia. Our activities are conducted under the auspices of the Government of Japan's Asia Health and Wellbeing Initiative, known as AHWIN, and they include not only dialogues, but also policy briefs and an award program, the Healthy Aging Prize for Asian Innovation, or HAPPY for short. The origin of today's webinar actually goes back to an exchange that JCIE organized last year to bring local experts from the United States, from the state of Ohio, to Japan to learn about how the country is addressing its aging population at the national and local levels. One topic that was of particular interest was the intersection between Japan's frequent natural disasters and its rapidly aging population. Sadly, as we learned, the vast majority of victims of such disasters are older residents. Japan, of course, faces a threat of earthquakes and tsunamis, but climate change has also increased the severity of storms, heat waves, flooding, landslides, and other types of disasters. And the ability of older people to withstand these types of threats is an issue of common concern around the world. The expert who met with our delegation last year was Dr. Hiroko Okuda from Japan's National Institute of Public Health. And she explained how Japan's policies on emergency preparedness and response to disasters have evolved in response to the loss of so many older lives over the years. Her presentation was so interesting and informative that we invited Dr. Okuda and her colleague, Dr. Jun Tomio, to contribute a paper to our AHWIN policy brief series on that topic, which is available on the ahwin.org website. You can find the link in the chat section. We're very pleased to have Dr. Tomio join us today as our lead-off speaker. Our fantastic panelists, whom you'll meet shortly, actually include one of our American delegation members who was at that session last year, a professor from Ohio State University who's been focusing on the intersection between climate change and age-friendly communities. She'll be joined by a representative of one of Japan's leading humanitarian NGOs, Peace Winds Japan, which JCIE worked with in the aftermath of the 2011 Great East Japan earthquake and tsunami. Our speaker is a nurse who was involved earlier this year in the medical response to a magnitude 7.5 earthquake that struck Japan on New Year's Day. And our third panelist is the head of a Thai nonprofit that does amazing work to support the health and well-being of vulnerable older people in his country. His organization won the 2020 Healthy Aging Prize for Asian Innovation. But today he'll speak about his organization's efforts to assist the government with disaster preparedness and response for older residents in particular. You'll meet the panel shortly, but to begin, let me first introduce Dr. Jun Tomio. He's the director of the Department of Health Crisis Management at the National Institute of Public Health. Dr. Tomio has worked as an emergency physician at the University of Tokyo Hospital and the Tokyo Metropolitan Bokuto Hospital. He received a master's degree in public health from the London School of Hygiene and Tropical Medicine, a European master in disaster medicine from the University of Eastern Piedmont in Italy, and a PhD from the University of Tokyo. After working as a lecturer at University of Tokyo's Graduate School of Medicine, he was appointed to his current post at the National Institute of Public Health in 2021. He currently conducts research and education in health emergency and disaster management. Dr. Tomio, please take it away.
Thank you very much, Ms. Ashizawa. And now I will share my slides. Just a moment. You will see the slides. Okay, good morning and good evening, everybody. I'm Jun Tomio from the National Institute of Public Health. And it's a pleasure to have an opportunity to make a presentation and share our work with you today. I'm originally an emergency physician and now engaged in research and education in public health, particularly in disaster and health emergency management. And today, I will talk along this policy brief, just Ms. Ashizawa mentioned, that I co-authored with my colleague, Dr. Hiroko Kuda. In this policy brief, we outlined Japan's legal system for disaster preparedness for older people and its historical transition over the years in response to past disasters. And we also provided some implications for countries and the Asia-Pacific region in light of Japan's experience. And first, let's look at the disaster situation in Asia and Japan. As you know, in Asia, an average of 90 disasters have occurred annually over the last 100 years. The more recent period, as shown in this figure, the more than 70% of disaster affected people were observed in Asia here. And in addition, as shown in the figure below, Japan is among the top 10 most disaster-prone countries in Asia. So the disaster management is one of Japan's most important policy priorities. Okay, next take a look at the situation of the population aging of Japan. As most of you know, we are now living in a super-aged society. According to the past trend and the future projection, the population started age rapidly from the 1970s around here, and by the 1990s, the proportion of the aged 65 or older exceeded 14% and making it an aged society. Then by 2010, it exceeded 21%, making it a super-aged society. As of 2022, here, the proportion of the older people is 29%, and the rest of working generation, the ratio of the working generation to the older generation is as low as 2. And the proportion of the households with older person is almost half. And according to the future projections, the proportion will increase as the population declines and approaching to as high as 40%. So in this background, the disaster preparedness that fully considers the needs of older people is an urgent issue. Okay. Now I would like to talk about historical transitions of the legal system based on lessons learned from disasters. First, the Nankai earthquake, which occurred in the aftermath of the World War II, caused significant human damage. In response, the Disaster Relief Act was established to provide emergency relief, protection of people, and preserve social order after the disaster. About a decade later, the Ise-1 typhoon struck and severely damaged the country. It was the most damaging typhoon ever recorded in Japan. And it caused human, property, and also economic impact. And that was beyond the scale of the Nankai earthquake. And in response to the Ise-1 typhoon, the Basic Act on Disaster Management was enacted to form the basis of Japan's current disaster management system. At this moment, Japan's population was still young, and issues related to older people were not yet evident. Over the next 30 years, Japan experienced rapid economic growth. The population rapidly aged, and shifting from an aging society to an aged society. The Great Hanshin Awaji earthquake occurred in this context. The earthquake caused extensive damage to modern cities such as Kobe, and it was also the first disaster whose impact on older people was widely recognized, as half of the dead were aged 65 or older. In response to this disaster, the Basic Act was revised, defining the elderly, people with disabilities, and infants as vulnerable groups in the event of the disaster, and requiring measures to be taken for those people. In years that followed, Japan became an aged society like this. In 2004, we had a lot of disasters. A series of devastating disasters struck the nation and caused damage to older people. Older people accounted for 60% of the deaths, and it was pointed out that evacuation delays, particularly in the event of heavy rains, may have resulted in excess deaths. Based on the lessons learned from this series of disasters, guidelines were developed for the first time to provide evacuation assistance for people in need during disaster. These guidelines require that information on older people and other residents in need of care should be shared by relevant parties, and that plan for evacuation assistance should be developed. Then in 2010, the proportion of aged 65 or older reached 23%, and the Great East Japan earthquake occurred in a super-aged society. As many of you know, it was a huge, complex disaster caused by an earthquake, tsunamis, and nuclear power plant accident, resulted in substantial damage. It was also a disaster in region with a more Asian population, with older people accounted for 2/3 of the deaths. The need of a list of people in need was recognized, the guidelines I mentioned in the previous slide. But at the time of this earthquake, the list was not adequately prepared. So the Basic Act was once again amended following the earthquake, making it a mandate of local government to prepare a list of persons in need of assistance. And the guidelines also have been revised. And this chart illustrates the procedure proposed in the new guidelines for developing and utilizing the list. First, the municipality prepare a list of residents in need of assistance and ask the eligible persons for their consent to be listed in the list, included in the list, and for the information to be shared with local supporters. Once consent is obtained, the list is shared with local supporters, and supporters keep watch during the ordinary times, and in the event of the disaster, they provide support for evacuation. And recently, disasters have occurred every year, and the population is aging increasingly, like here. And older people accounted for a higher proportion of deaths, and not only direct health impact of disasters, but also disaster-related deaths and secondary health damages that I will discuss later are increasingly recognized as an issue. While lists in local authorities have been developed through mandatory legislations, the sheer increase in the absolute number of older people in the communities have posed significant challenges in ensuring the effectiveness of these plans. So, since 2021, individual evacuation plans will be promoted, namely for more specific support plans. Okay, that was the historical overview of the Japan's legal system for disaster preparedness. Now take a look at the current status of preparedness. Regarding the list of persons requiring support for evacuation action, all municipalities, all more than 1,700 municipalities have finished their listings. However, for individual evacuation plan, only 9% of the municipalities have completed the development plans, and a quarter of the municipalities still need to be prepared. So we understand that municipal officials face a significant burden on preparing individual evacuation plans and recognize that progress is a bit difficult. Okay, now let's look at the health issues for older people according to the relating to the disasters. The older people are at high risk of not only direct health damage, but also disaster-related deaths. So what are disaster-related deaths? So they are the deaths that occur as a result of deteriorations in their physical conditions due to evacuation and other related factors after disaster. This chart shows the direct and disaster-related deaths in 3 large earthquakes. At first glance, it is very clear that about 80% of the deaths of the Kumamoto earthquake were disaster-related. Here I listed some factors associated with disaster-related deaths from past disasters. For example, in the Great East Japan earthquake, 90% of disaster-related deaths were observed among aged 70 or older, and there are common causes such as physical mental fatigue from living in shelters or during transportation to shelters, and aggravation of pre-existing diseases due to the shutdown of medical facilities. The place is also important, and living environments where the disaster-related deaths were found are hospital nursing care facilities, and same place as before the disaster, such as home and shelters. In order to prevent disaster-related deaths, the guidelines have also been developed to improve shelters and living conditions during and after disaster. These guidelines require the municipalities to provide a support system for older people, and others, considering the following points: the securing space in shelters, and procuring necessary nursing and medical supplies, and coordinating the confirmation of individual safety and so on, even for those are sheltering in place at their homes. And although there are many challenges, several efforts are underway to prepare for future disasters. For example, this siloed administration relationship between disaster management department and welfare and health department is often a problem. But it is important that these relevant departments work together and cooperate. So in some municipalities, as shown in this figure, there are also systems in place where those in charge of handling long-term care insurance services and those in charge of preparing individual evacuation plans in the event of the disaster work together to provide effective plans and plannings. Okay. Finally, I would provide some implications for Asia. Countries in the Asia-Pacific region share common contexts such as increasing frequency of natural disasters and rapid aging population. As shown in this figure, the proportion of age 60 or older among the developing Asia countries is now 13.5%, but will go up to 25% in 2050. So given this background, some suggestions for better preparedness include developing effective legal systems, and identifying older people in the community and also planning for evacuation support, even from normal times. Okay, that's a final slide. And before concluding my presentation, this is just outside of the scope of the paper, but I briefly mentioned the Noto Peninsula earthquake that occurred on New Year's Day this year. As the next speaker will discuss the details, the earthquake occurred in an area with an extremely high proportion of older people, as high as 50%. Due to its severe weather conditions and the extreme extent of damages of infrastructure such as water supplies, people were forced to evacuate broader areas and for a long periods. In addition, as I indicated earlier, individual evacuation plans were not fully prepared also in these areas. Now, 6 months have already passed since the earthquake, but the recovery efforts are still ongoing, and we should learn again from these disasters. Okay, now I would like to conclude my presentation, and thank you very much for listening. And can I hand it back to Ms. Ashizawa or Abe-san?
Yes.
Okay. Thank you very much.
Okay, thank you. Let's see.
And just stop the share.
Yes, please.
Okay.
All right, great. Thank you for that very informative presentation, Dr. Tomio. I'm sure our audience is going to have a lot of questions for you at the end, but for now, let's turn to our panel presentations. I'm going to hand the reins over to my colleague, Momoko Abe, who will serve as our moderator for the panel discussion and the Q&A session. Momoko is the head of our of JCIE's Japan-based team for our aging-related programs. Momoko, over to you.
Thank you, Kim, and thank you, Tomio Sensei, once again for the very comprehensive presentation. Now, let's move on to the panel discussion where we will have 3 panelists who are also working in this field of disaster response and preparedness and will share the approaches from their respective positions. After that, we will have Tomio Sensei join the panel and we'll have a discussion among the group. We would take questions from the floor during then. So if there are any questions you'd like to ask the speakers today, please post them in the Q&A box, which I believe is available at the bottom of the screen you are watching. So now I would like to invite our first panelist, Ms. Tomoe Kikuchi. She is a registered nurse and medical manager for the ARROS project at Peace Winds, Japan, actively working in disaster relief, community healthcare, and international cooperation. She has provided support for earthquake relief in Turkey and assisted Ukrainian refugees in Hungary in 2022. Her deployment experience with ARROS includes responding to the 2023 Morocco earthquake and the recent Noto earthquake, which Tomio Sensei just highlighted. I'm not going to read her whole profile since I believe she will be covering some of it. And I'm sure the audience is excited to hear about her work in the front line of emergency response and disaster management. So now over to you, Kikuchi-san.
Thank you very much, Momoko-san. So I will share my slide. It's okay? Okay. I will start. So good morning and good evening, everyone. My name is Tomoe Kikuchi from Peace Winds, Japan. In my part, I'm talking about the needs and challenges of elderly evacuation support based on our experience with the Noto earthquake in Ishikawa Prefecture. So Peace Winds was established in 1996 and has carried out projects in 39 countries. Our mission is to quickly help those suffering from conflict and natural disasters. During the Noto earthquake in January, we have been providing ongoing support in Suzu City, starting from the second day after the disaster until now. Anyway, let's get to the main topic. Let me introduce an overview of Suzu City. Suzu City has about 12,000 people. Of these, 51% are 65 years old or older. This is the number of deaths and the number of evacuees in Suzu. Immediately after the disaster, around 8,000 people evacuated, and there were 93 evacuation shelters as far as we know. Needs and challenges right after the earthquake. Presence of elderly people who cannot reach evacuation shelters. According to Ishikawa Prefecture's report, over 70% of those who died from house collapse were elderly people aged 65 and over. Many elderly people have age-related hearing loss, and most information immediately after the disaster is communicated through audio, such as emergency broadcast and evacuation calls. That means they may miss hearing important information, which can be life-threatening. The challenge is living in evacuation shelters. In Japan, evacuation shelters often make people live on the floor, especially right after the disaster. Once they lie down, it becomes hard for them to get up and move to the toilet. As a result, many spend their time in wheelchairs without lying down, or face the risk of becoming bedridden if they need help to sit up. Also, nutritional issues are also serious. The food from relief supplies was not good for those with swallowing difficulties or dental problems, so proper meals were not available. Additionally, many elder people forget or run out of their prescription medications, even though mobile medical teams like us visited shelters. But many elderly people didn't know the name of their medications, which caused their health condition to worsen. Next, about the needs and challenges in the months after the disaster. Most significant challenge has been the loss of community. Moving from evacuation shelter to temporary housing provides a safe and private living environment, but the pre-disaster community is lost, leading to increased isolation among the elderly. This isolation can result in inactivity, depression, and even suicide. Previous relationships are lost, and it's difficult to build new ones. Also, stopping welfare service has been a big problem. Service providers were hit by the disaster too, so many elderly had no choice to move to other cities. This made them feel more isolated and lonely in new cities. In this context, I will also discuss the current status of Japan's individual evacuation plans. According to our Cabinet Office survey last October, only 8.7% of local governments in Ishikawa Prefecture had completed individual evacuation plans. Many of these plans lack detail, such as locations, route, and support personnel, and some reported that they were unfortunately ineffective. Regarding information sharing, some local governments hesitate to share information due to privacy concerns. But in May 2023, Suzu City was also hit by an earthquake. These winds quickly started door-to-door visits, 3 days after the disaster. This quick action was largely due to the city's prompt sharing of the list of people who needing assistance. What we can do to prepare for resilience? First, it's helpful to include elderly people in training and events. Most disaster drills focus on healthy individuals. It's important to involve those who are directly affected. Second, understanding local healthcare and welfare system might help. Many external support organizations prioritize shelters and disaster hospitals. Knowing the usual service and resources for the elderly can make it easier to meet their needs during disasters. Enabling early support and potentially reducing disaster-related deaths. Third, creating individual evacuation plan is, of course, important. This shouldn't be left to local government alone. It could need cooperation with the community and organizations that support the elderly. It's also helpful to think about how to share information with external support organizations during emergencies. Finally, in modern Japan, the aging population is growing and more people need help. However, there are fewer people available to provide support due to weaker community ties. It's hard to depend on only self-help, mutual aid, and government aid. AHWIN stressed the importance of public-private partnership during disasters. By improving information exchange and cooperation even during normal time, we can support the elderly effectively. Using grassroots network may help us overcome the limit of government and provide quick and flexible support. Thank you for listening. So I will pass Momoko-san.
Thank you, Kikuchi-san. And I guess your presentation provided us many important insights and the actual needs from the front line. So thank you very much. And the next speaker is also speaking from the local perspective, but will be in the context of Thailand. So I would like to invite Mr. Sawang Kawakenta, who is the Executive Director of the Foundation for Older Persons Development, also known as FODDEP. Kun Sawang plays a key role in community-based care development to empower older people, and FODDEP runs a wide range of programs which includes poverty reduction, healthcare access, but today we will have him speak about the age-inclusive disaster risk reduction. Kun Sawang, the floor is yours.
Good morning, everyone. I'm very pleased to be here with you and talk about the disaster preparedness and response for the aging population. Next, please. First, I would like to give you the broad idea about the what FODDEP is. Our mission or goal is to work with and for older people in Thailand to improve the quality of their lives. So this means anything that affects to older people, we will address with that, to address to that. The area of community-based home care and that we provide adapt into body home care social enterprise. Income security in old age is one of the issue that we should focus on. It's not only the older people in this decade, but in 20 years, 10 years, 20 years, how the older people live without population when they are still working. Human rights of older people, this is another area that we are focusing on. And certainly for this presentation, disaster risk reduction and climate change adaptation. This is the very new to us because we just started after the earthquake, heavy earthquake in Japan in 2011. And that was the year that the Bangkok and the central part of the country was under the water for 3 months. And then after that, we started the what you call the community rehabilitation by empower the older people association to work on this, because many older people, they think they have enough work, so they stop, but they have experience, expertise, and they're healthy. So we empower the active older people to help the disadvantaged older people. And again, right now, we just started from the early of this year is a humanitarian because of the conflict in the neighboring country like Myanmar and the influx of the older people, part of them to Thailand. So we start on that. And with this era, media and digital literacy is very important for the older people because they are exploited by the online cheating or something like that, if you like. Next, please. Yeah, yes. So type of disaster in Thailand is nothing to do in comparison with Japan that I have seen before earlier, because Thailand is very mild. So what type of disaster in the country, like a flood, rapid flood, landslides, earthquake, very mild, about 5 to 7. 7 is the highest. 7 Richter is highest time that we experience. Air pollution and PM 2.5 is very heavy. It's not only in Thailand, because of the haze, of the slash and burn, not only in Thailand, but also somewhere else along the border. Biological hazard COVID-19 is also that we concern as the disaster. Climate change, climate-induced hazard like a drought and extreme weather. This all the area that we are focused on. And this as a risk reduction, because there are a number of active aging that who retired at 60, whereas in Japan it's 65, Japan and other countries with 60. So we see that the expertise, the experience of active aging. So we try encourage those people who work on like older people association, not to, they are good in working for themselves and the member, but we encourage them to work for society, particularly to support the disadvantaged older people and the other people who need, for example, the people with disability, the pregnant women or whatsoever. So approach, how do we work that? We work in collaboration with the local authority, or you can say that municipality, whatever it is, OPA, the Older People Association, and community-based organization, that is, NGO or CSO exist in community. We from the we are not the doer in this committee, but we are facilitator to facilitate them to work for themselves. Like we help them to help themselves. So approach like a learning, collaborating network with the CBO and CSO network on the disaster risk reduction and climate change adaptation. Having done this, we also voice for policy engagement and national policy suggestion in local level for local authority and national level. Public awareness raising also. Emergency response, relief and rehabilitation in Thailand, flood response and relief. So this is after the disaster. So we provide the local community rehabilitation, particularly with after earthquake, the mental health. People are worried about the aftershock or something like that. So PM, it's all the area they were working for. So in future plan, we will scale up in our work in the northern Thailand and try to generate into other places, particularly in the south and northeast. And again, we disseminate the best practice through the regional network as well. So this is our work, very, very tiny, because we just started maybe 10 years ago. So next, please. Next, please. Yes, this is the reference. So this is supportive information. If you need more, you can go to this. Okay. So thank you very much. Within 8 minutes.
Thank you, Kun Sawang, for keeping the time punctually. And you mentioned it's tiny, but I don't think so. And I think the work that you've been doing is really important. And it raises the awareness that though depending on the region, the type of disaster might be different, but still this issue of disaster risk reduction is something universal. And that is why we are all here today to share our experience. So let us now travel across the globe from Thailand to the United States, where we will be hearing from Dr. Holly Dabelkoshoni, who is the Director of Research for Ohio State University College of Social Work's Age-Friendly Innovation Center. She will be sharing us about her work and initiatives in building age-friendly and climate-resilient communities. Good evening, Holly, and thank you so much for joining us today. Over to you now.
Thank you so much. Thank you for the opportunity to speak with all of you and to learn from all of you this evening. I'm going to share my slides here. So I'm speaking tonight on behalf of a large team, my colleague, Dr. Smitha Rao, as well as a number of colleagues with the Age-Friendly Innovation Center at Ohio State University, where I am a professor and a director of research. Some of the work that we do is associated with emergency preparedness, related specifically to impacts of climate change. The mission of our center is to innovate with older adults themselves through research, education, policy, and advocacy, in hopes of creating community in which individuals feel included and have a sense of resiliency as they age in community. Part of our program, our center, is the Columbus and Franklin County Age-Friendly Community. We are part of the World Health Organization's global network of age-friendly communities, in which there are 1,542 cities and communities around the globe, representing over 320 million people. In fact, there are 24 age-friendly communities in Japan And thanks to JCIE and the Japan Foundation, a group of us from Columbus had the opportunity to visit Tokyo and Kanagawa Prefecture and to learn directly from individuals who are involved with the age-friendly community work in Japan. Being part of the national or the international network of age-friendly communities involves having the highest level of government official commit to joining the network and committing to at least a 5-year plan in which you conduct a community assessment about needs, develop an action plan, and then implement the various strategies that are associated with that plan, and then evaluate your efforts. Being an age-friendly community does not mean that you are doing everything right. It means that you, as a community, has committed to improving the level of livability for people of all ages. The World Health Organization has identified these 8 domains as being critical to supporting one's ability to engage in community and age well. You can see these various domains: transportation, housing, emergency preparedness, inclusion, social participation. None of these domains explicitly speak about climate resilience and climate change activities. And my colleagues and I have been working to encourage dialogue across these systems and structures to consider climate and climate resilient activities. In fact, we partnered with Ohio University and Dr. Jeffrey DeBelco to make an argument to create an additional domain that specifically speaks to climate resilience. And this domain certainly interfaces and intersects with the other established domains. We recently published a paper in which we make this argument. I'm pleased to say, as part of this work, our team has recently been in discussions with the World Health Organization about establishing a knowledge and action hub that specifically the intention of which is to specifically share knowledge and information about preparedness, disaster response to climate change, climate impacts that consider the unique issues of individuals who are aging and those who have disabilities. Just to give you a quick orientation to where we are in Ohio, the orange state there, we are a landlocked state in the US. The types of climate impacts that we are working on are primarily issues of extreme heat, which we're experiencing actually right now, flooding, power outages, and severe weather. So both snow and ice, as well as substantial rain. We started our work by trying to address the silos between the aging services and support networks and issues of emergency preparedness. Some of the other previous speakers talked about the importance of the interface of social welfare and also emergency and disaster preparedness and response. We conducted an assessment of our region to ask questions of older adults themselves about their experiences in being prepared for emergencies. Our Federal Emergency Management Association has guidelines that identify what types of supplies one needs to have on hand. And so you can see that we found that about a quarter of the folks responded that they were not, did not have 3 days of these supplies, nor, or they didn't know if they had that. We also asked about a variety of weather disruptions, as well as supports in their homes. What we found most interesting was we had individuals who were living in rural counties in our state faced many more disruptions as a result of extreme weather. The QR code here on the screen will bring you to our full survey and our dashboard online if you're interested in looking at more of our data. My colleague, Dr. Smitha Rao, led the writing a paper about these emergency preparedness and weather disruption activities and experiences of older adults, and looked at some social vulnerabilities in those counties to take into consideration. So we are working to make sure that we're talking about climate and climate resilience within the context of older adults. We are collecting information and sharing information about what's going on. Now we are focusing on creating models for those who are at the highest risk of negative impacts of weather-related disasters and disruptions. We're doing that through the Weather and Aging Resilience Model, our WARM model. We have a big partnership here with folks at the university, as well as our AREA Agency on Aging, which is our community-based, government-based aging services organization. Our approach is to take the experienced experts, the older adults themselves, to learn from them about their experiences, couple that with scientific experts, our academics, and practice experts, those people who are delivering services in the field. So we are looking at and working with a low-income housing property in our community. We know that our lower income, higher disabled, and high density areas where there are a lot of older adults live are where we want to focus our attentions first. So in this study, we are learning from older adults themselves about their experiences, as well as service coordinators, so professionals who work with those older adults to connect them to services, to build a toolkit in which we hope to replicate and provide supports to the 10 million individuals who live in low-income housing in our country, of which almost 2 million are older adults and people with disabilities. We conducted surveys with residents as well as the service coordinator professionals and focus groups. We have some preliminary data, findings that we learned from our conversations. Many of these same themes that we have heard from previous speakers, transportation as an issue, folks who don't drive, experiencing power outages, not having an evacuation plan when needed. These individuals tend to be in poor health as well. And what we learned from service coordinators, and these are service coordinators actually from 9 different buildings in our community, is that they are very concerned about disasters. They say that the residents are not prepared and that they themselves lack emergency preparedness training. And so it really reinforced the importance of us having these conversations, providing education, and putting together a toolbox or action plans for folks. Again, these are themes that we identified in our focus groups. You can see these are the same themes our previous presenters have talked about. Transportation, shelter, having to evacuate and the complexities associated with evacuation. And also power, what it means when we lose a source of power. So our next steps now are to take this information and work with older adults, service providers, and academics in innovation sessions in which we will do some tabletop exercises and put together resources and tools to support these older adults who are living in low-income housing. Thank you.
Thank you so much, Holly. I think you've covered for us the importance of assessing the community challenges from various angles and systematically assessing those by breaking up into several domains as well. So thank you so much for the informative presentation. And now I would like to move on to the discussion part. So may I ask all speakers to turn on their cameras, and we'll have a gallery view of everyone in one screen. And to the audience, English, Japanese interpretation will be available from now. So you could select the main channel you would like to listen to by clicking on the language button. I guess there will be a globe button showing on the bottom of the screen where you can choose either English or Japanese. And so we will soon be picking some questions from the floor. So if there are anything you would like to ask the speakers, please feel free to post them in the Q&A box. And I'm already seeing some questions getting in the box. And you can actually ask questions either in English or Japanese if you prefer so. And speakers as well, for our Japanese speakers, will have the liberty of responding in Japanese, but just be careful of choosing which channel you are listening to, or else you will not listening, you can't hear any audio in some cases. So, thank you. So now let me start the discussion by asking Dr. Tomio actually for his initial comments on the points raised by the panelists. And then I'll pose a few more questions before shifting to take the audience questions. So Dr. Tomio, may we have some of your comments, please? Thank you.
Thank you, Abe-san. And thank you very much for the fantastic presentation for three of each presenters. And first, San talked about the activities of the Peace Win Japan. It was very fascinating, and the Peace Win Japan reached a very hard to reach place after the Noto earthquake, and did a great job for the helping the elderlies and other affected people, and did a great job for the relief work for the Noto Peninsula earthquake. And I also impressed that Peace in Japan I thought that it was a relief focused on the emergency relief, but also they are tackling to the some kind of community work in times of from the normal time, and they build some resilience in the community, and even before the disasters. So I think that kind of work by the nonprofit organization like Peace in Japan will contribute a lot for the disaster preparedness in Japan. Okay, thank you very much. And for Mr. Sawan talked about the project.
すいません。またタイの発表に関しては。
Actually, I mentioned about the individual care plan, but it was only for the natural disasters defined by the Basic Act of Disaster Management in Japan. But your project are focusing even air pollution and biological hazards and climate change. And I think that older people are very vulnerable to all that kind of hazards. So it is very good idea to focusing on the different hazards, multiple hazards, like all hazard approach. So we have to learn from your project about the your project that is promoted in the Thailand. And finally, the professor, the Balkushoni, showed us age-friendly initiatives. I didn't know about age-friendly activities, but it was very interesting, and they are much more focusing on the community life at the normal time, and they produce some kind of relationship, the community relationship in the normal time, and to facilitate that activities to the emergency preparedness like climate change. So that is beyond the disaster preparedness and kind of a work to enhance the power of the community by all ages. So I don't think that kind of work is prevalent in Japan. So we have to learn more about your Ohio project. Thank you very much. That's all from me at this moment. Thank you.
Thank you so much, Dr. Tomio, for the encouraging comments as well. And I guess we have many information to learn from each other today. And so now I would like to ask a question specifically maybe to Holly and Kung Sawang that about what are the takeaways that you thought can be learned from Japan's effort to create systematic approaches at the local municipality level for disaster preparedness, like in shaping the legal system and guidelines for evacuation support. So Holly, can we start from you?
Sure, I'm happy to start. In reading the research brief and looking at the figure in identifying the individual plans, that model is something that we would love to see on a smaller scale in these low income affordable housing properties with older adults. So many of these properties have 100, sometimes up to 200 older adults who have high levels of disability, who are low income, who are so often socially isolated, who don't have family supports outside of those that property. And looking at that model in which is being implemented, understandably so, there are some challenges from moving from identifying the folks on the list to actually creating those plans. So I'm curious to learn more about the barriers in that process. But that type of model could work very nicely in a voluntary way within our affordable housing properties across our country. And as I mentioned, there are about 10 million folks who live in those types of properties. So that's one specific example that I can think about right away, that we can continue to build our toolbox to share and test and replicate.
Thank you, Holly. Kun Sawang, how about from Thailand? I think you are muted, sorry.
From the presentation I read before about the how to cover, how to, what do you call, cope with the disaster in Japan, I can see that the severity is very high and compared to the disaster in Thailand. So, but preparedness is a good way because So, that's why we focus on preparedness, like to educate the people, the community, and get the local authority to work with, directly to the community. And after you can see that every time when they have the something like disaster, flood or landslide, but evacuation, they are the mechanism in local authority, they do that. But after that, what's happen? That's the role of public to work on for community rehabilitation. For example, like earthquake in Chiang Rai, the neighboring province of Chiang Mai, and the people could not sleep because they are worried about the aftershocks. So mental health, no one pay attention on that because they put on the evacuation right after or right at the action. So the role of public is to build capacity of the community, how to cope with that if it happened again. So this is how we prepare the community, and we are not the doer, as I said later. We facilitate the community to help themselves, help them to help themselves. So, for example, like this, and we also now run just this year, start this year for the community resilience on financial security in older people, as well as the stabilization of the livelihood, particularly on the older people. We work with this South Foundation, Singapore, Cambodia, and Philippines, and India on the community resilience. Also, this is result also can address the problem of the disaster risk reduction.
Thank
Do
you,
I answer your
Samon.
question, Moboko?
Yes, thank you so much. And I guess in the presentation as well, you raised about the other speakers as well raised about the importance of mental health.
Yeah.
So yeah, I guess we cannot be enough in being prepared for disasters, but still preparing like a evacuation plan could still relieve maybe some of the mental health problems on the field. So I really found the point on evacuation plan really important in this context.
Yeah.
So maybe my next question can be directed to Ms. Kikuchi. And actually, we've seen from Dr. Tomio's presentation that the needs in disaster response differ in areas with different population structure, like more aging demographics, more higher density of older persons. So what are some demographic and maybe cultural differences that you've encountered or should be considered when dealing with relief efforts around the world, maybe based on your experience? Yeah, mute again. Yeah.
Sorry. I will talk in Japanese, sorry. はい、高齢者の避難活動に対して
For older population, what would be the cultural or demographic considerations? I think it's a very difficult question, but what could be said in common, the elder population may have difficulty walking or may not have the acute sense of decision-making abilities, and those may be commonalities. So whenever a disaster occurs, in Japan, there are many communities where it's mostly older people, they're elderly, and so they have difficulty in deciding when and where to evacuate. And some have become victims because of that lack of quick decision-making. So in Thailand, when you have that community inclusiveness, sharing information, that people are calling out to each other to evacuate together, I think that's a very important element. But in order to be able to do so, you have to know who is in your community, what kind of people need the assistance, and who do you need to keep an eye on unless you have that information during normal times. So we need to build up the capacity of communities during normal times and know who are the residents.
Thank you very much for the answer. And I guess we have one question from the Q&A box, which is also asking about the evaluation plan. And the question is, how do you suggest we motivate older persons to make an evacuation plan? So I guess it's the question is also asking about the including older people in making such evacuation plan. But maybe can I ask Kun Sawang in how you're handling this in your context?
So we when we work in community, not only the output that we look for, but the impact of this look for the social change of the building capacity of the community. So currently on the work of this disaster risk reduction in community, we are focusing on the social of investment return. So we evaluate on that also. So sometimes we plan to build the community to run along with this. So they can learn along with us. So we ourselves, we don't have the the researcher or academia people in this. We work with university, and this is how we work, how to educate the people in community to cope with this, and what we call is a kind of participatory evaluation in the community. So this is the way we do in evaluation. But we sometimes we what you call have the MOU with the university, for the Chiang Mai University, to consult with them and have the help us with the evaluation.
I guess that's the you've also pointed out the involvement of academic in doing like a multi-sectoral approach in that sense.
Yes. Yeah. For example, like the house repairing or house renovation, we talk to the faculty of architecture of university, and they can provide students to assess or assess the situation of the house and to build the like a more stable house for the older people, something like that. So we work with the network. We won't go alone in community. So we try to mobilize the resources available around us or around in the community, particularly the local authority, because they are the main role of the local authority to work in the community, but we support them. Sometimes they miss something, we can support them.
Thank you. Holly, any comments from your side?
Yeah, we definitely continue to learn how best to motivate, engage older adults to take the steps necessary to be prepared for emergencies or disasters. And our approach has been to include and engage with them directly so that they are able to identify what are the problems and challenges they see. So we work very hard not to come in and tell them what they need to do, what the risks are, but we engage them in conversations to share with us what are their worries, what are they concerned about, and then engage them in co-designing the solutions. And so having conversations so they're invested in these problems feel meaningful for me. These are the solutions that make sense to me. And our second phase of this WARM project, we're actually having older adult ambassadors. We're going to identify older adults who can then go speak and interact and assist other older adults in affordable housing or low-income housing properties about their experiences in preparing for emergencies and disasters.
Thank you so much, Holly. And I would like to take another question from the Q&A box. And this is a question to all speakers. I guess it's a bit tricky, but it says, for better collaboration among multiple stakeholders to better coordinate disaster preparedness in the community, taking into consideration the protection and health of older people, who do you think is ideal to take the leadership role for such an initiative? So I guess there's no maybe like an correct answer for this, but maybe we can ask for the speaker's opinion. And Dr. Tomio, can we start from you?
Okay, thank you very much. And that's a very difficult but great question. And in Japan, the many communities, especially in the rural area, the proportion of aged older people is very high and sometimes exceed the number of the city officers or town officers. So it is very difficult to manage the older population by the public sectors. However, there is some movement that produce a Council for Independent Life Support. I put that name on the paper on the figure 3 of the paper, and that kind of organization, which is composed by the public sectors and also the private sector and the non-profit sectors. The leader of that kind of council can be a candidate of that kind of leader, I think. The organization coordinate, for example, some problems among the older people or problems among the disabled populations in the community. So that organization or council can be a kind of a key organization to enhance the resilience in the community, I think.
So you are referring to the supporters, like the local welfare commissioners, and okay, thank you. So Kikuchi-san, maybe we can go over to you.
Yes, it's also a very difficult question, but in my opinion, I think local government leader is a good position. Yeah, because but depends on area, because if big city areas, so it's very weaker communications tight. That's why it's very difficult to local government leader will be leader, because they cannot control handling all of the residents. But a rural area, I think it can become the leader of local government leader, I think, in my opinion.
Yeah, so I guess it depends on the scale of the municipality again, like in Tokyo, if it is urban area, or in rural areas where the the scale may be a bit smaller, and the community bonding, if it is strong. So I guess it's different. It has difference in various contexts, and that is also like another difficulty in dealing with disaster response. Thank you. Kun Sawang, maybe can we have a comment from you?
Can you repeat that again? The question.
No problem. So it's a question in the Q&A box, like asking like for the protection of taking into consideration the protection and health of older people. Who do you think is ideal to take the leadership role for such an initiative?
Oh, I think can be any organization on here. And yes, with this, first, I want to thank JCIE, that your role is the international exchange. And I think this is the good way to start, but who can lead on the community exchange that maybe they could do it, but I need to discuss with my colleague who has a hand-on experience in doing this. We are also like at the learning place for this region, like the group from the Philippines and led to use FOPDEP area is the like the learning place for the community resilience, as well as I just mentioned, we just started community resilience on income security and livelihood of the older people. So this is the good area that we can start with it. And South Foundation is very good on this, but we have to, they are not here, so I cannot propose them.
I see. Okay.
Yeah.
But I guess,
among the, we can discuss with this further on along the Help Age International Network. Or for example, like the Philippines. I think next to Japan, I think the Philippines is like the disaster prone. I mean, so I can see that the severity of the Japan is very high, and next to that, the monsoon start from the Philippines and then affect to help it to Thailand, but to Vietnam, to something like that. If we have the these countries have to, provide the floor for the people for the organization from these countries to discuss and maybe virtually like this, but led by the Japan Center for International Exchange. This is the good floor, I think.
Thank you. So I believe this is just a start of like our knowledge exchange. So like seeing from the interest of the audience as well, then like because we have many questions, and in the interest of time, I guess I could only take maybe one more question, but this is just the start. So as Kun Sawang mentioned, and we can make this conversation going, and since we also have the policy brief that Dr. Tomio and Dr. Hiroko Okuda wrote for us, then that can be one platform as well. Okay. Sorry, Holly, may I ask your comments on the earlier question on the who should take the leadership in this?
You know, I think ideally it's a collaborative leadership approach. That's going to be dependent on really good communications and really good and strong relationships that have been built in times when we're not facing emergencies or disasters. So thinking about local governments, the nonprofit sectors or service delivery providers, and older adult advocates themselves, older adults who are passionate about this issue, and different groups that are passionate about preparing. And having a collaborative leadership model, I think, is really what it's going to take to address these very complex issues. In order for that type of leadership model to be successful, though, there's got to be strong relationships and really good communications and systems and structures in place that support information sharing, collaborative responses, and community engagement.
Thank you so much, Holly. And I guess you've mentioned like the importance of the older persons themselves as advocates in this issue. So I guess I'm afraid in the interest of time, then we could that would be the end of the Q&A session. And for those of you who would like to ask more questions about the respective speakers, maybe you can send an email to us and we will refer those questions so that you can get some answers from the speakers. So my apologies in we are not being able to take all the questions, but I would like to thank again all the speakers who are present today for their wonderful presentations and the insights they provided through the comments in the panel discussion. So thank you very much to all speakers. So to close the session, I would like to invite Dr. Takuma Kato from ERIA, the Economic Research Institution for ASEAN and East Asia, to give us the closing remarks. So Takuma-san, over to you now.
Thank you, Momoko-san. Hello, everyone. I'm Takuma Kato, a director of healthcare unit in ERIA, a co-organizer of the webinar. Thank you very much for joining us today. And thank you very much, Dr. Tomio, for your informative keynote presentation. And thank you to all the distinguished panel members. I'd like to express my great appreciation for your valuable and insightful discussion today. So actually, ERIA is located in Jakarta, Indonesia, which is also one of the most natural disaster-prone countries in the region. So natural disaster is not news in TV or YouTube, but it's real issues. Although Indonesia has made a great effort to mitigate the impact of disasters and has led a number of regional activities to develop the capacity to respond them. More and more assistance will be needed, particularly for vulnerable people, including elderlies. I believe Japan can significantly support to make a more resilient country and society in the region based on a lot of experience. So once again, thank you very much to all guests and panelists and to our audience. We, JCIE and ERIA, really appreciate your kind attention. And JCIE and ERIA have worked for raising awareness of aging issues in Asia for more than 7 years. Besides today's webinar, we organize Happy Award, Healthy Aging Prize for Asian Innovation, as our flagship. This award aims to collect and disseminate best practices in Asia so that those can be copied or modified to adopt your own countries, own communities. The winner of Happy will be announced this autumn. I would be grateful if you would keep your eyes on our activities in this topic. More detailed information is available on our website at AHWIN.org. AHWIN.org. You can find our past webinars and learn more about Asian topics in Asia as well on the website. Once again, thank you very much to all of you today. I hope to see you again soon.